Hi, I'm Dr. Rita from Breeze Orthodontics. We're so excited that you're starting your orthodontic journey with us. We'll be sharing some tips and tricks to help you navigate this process with ease and breeze. So it's important for you to wear your aligners 22 hours a day. And also we'll give you a nice little case. So if it's not in your face, it's got to be in your case. Okay? One of the most important things you should remember is that in order for my prescriptions for your teeth to be fully expressed, the edges of the aligners has to be touching the edges of your teeth on each individual tooth. So it's very crucial that they're fitted like a glove.
So the second part you need to know is that while their Invisalign trays are in your mouth, you want to use Chewies. So these are what we call Chewies, and we're going to give you at least 3 of them, and we want you to chew them at least 20 minutes a day. So 20 minutes is the magic number. They do 2 important things. The first thing, it stimulates osteoclasts and osteoblasts, which are bone-making molecules to move your teeth. The second, it removes any air bubbles. So air bubbles are any gaps, if you can see, between the tray and the tooth. You want to make sure that the tray seats properly, which means that there's no bubble, just like this. So you're going to chew on it until there's no bubble. Dr. Rita likes to say to not move on to your next tray if you see an air bubble, because the air bubble shows that your teeth are not tracking, which means that they're not moving the way that Dr. Rita wants them to move.
So many orthodontic patients also have a tongue posture, EMJ, and breathing issues. So we like to give you some exercise to help you with those. So there's 3 main healthy habits. Number 1 is nasal breathing. So you should only be breathing through your nose, lip seal, and number 3, tongue on the roof of the mouth. So the tongue exercises we like you to do is number 1, the push-up. It's also called a cave exercise. So you open your mouth and you press your entire tongue against the roof of your mouth. You do that a couple of times. You hold it for 10 seconds each. Close, open, and close. Like this. The second exercise we like you to do is a popping sound, like this. So that way it increases the tonicity of your tongue. Some ways to keep your aligner in their tip-top shape is to clean it with soft bristle toothbrush. You can just clean the inside of it that way. You can use dish soap. You can also use hydrogen peroxide diluted to 50%, orthofoam, or the cleaning crystals in your case. Definitely do not use toothpaste because they could make your aligners look cloudy, and we don't want that. Some tips to avoid staining your aligners in your teeth is to avoid wine, coffee, cranberry juice. That could cause the staining of your teeth and aligners and your attachment. If you must drink those, I would highly recommend that you drink them through a straw.
When you get your Invisalign trays, they're going to be coming in a few of these blue boxes and your case. Every time you come visit us at Breeze Orthodontics, we ask you to bring all your cases with you and all your boxes. Every time you change a tray, we ask you not to rip and tear apart between each plastic case. So they come just like this. And we ask you not to rip them apart right here. We ask you not to throw away any trays or break them. So just come with all your boxes intact, put each tray after each use back into its plastic baggie, and don't rip any of the plastic bags.
So now we will teach you how to put on and take off your Invisalign. So starting with putting on your Invisalign, you want to make sure your trays are lined up completely with your teeth. Don't push up yet. You just want to make sure they're all lined up. And once you see that they're all lined up, especially if you have crowded teeth, you want to just push up and make sure you can use your thumb. Just push up like that on all areas, especially the molars. And then now I will be teaching you how to take them off. So starting with the upper, you want to pull down and outwards away from your mouth, and that is to avoid taking off the attachments that we put on your teeth, because if they're not on there, then the teeth can't track. And so what you want to do is start from one side, whichever, it doesn't matter, just whatever's more comfortable. So you want to use your thumb and your index finger and pull down and outwards, and you just kind of want to go in a rainbow and pull out and down, and like that. And it's also the same thing for your lower, but instead of down, you pull up.
If you ever want to download the app called Trayminder, it looks just like this with a few dots right there, and it'll help track whenever you need to change to your new tray.
Thank you so much for choosing Breeze Ortho. I'm so excited to be on this smile journey with you. If you have any questions at all, please feel free to connect with us. We're so excited to see you again.